Joining us today on Morning Blend is Dr. Joel Cohn, cardiologist at Sparrow TCI. Dr. Cohn, in honor of February being Heart Month, we're discussing peripheral artery disease. What is that?
So peripheral arterial disease are blockages in the arteries that exist outside the heart. In territories that could include the leg, the arteries that go to the kidneys or the gut, the arteries that go up to the brain, the carotid arteries, or even the arteries that feed the arms and the extremities, upper extremities and lower extremities.
How does one diagnose that?
Well, that's an interesting question. Sometimes it's diagnosed by symptoms, where people start developing discomfort in their legs when they walk, or pain, or where people start having pain when they eat meals, or unfortunately symptoms that include stroke and what's called a transient ischemic attack, where there's interrupted blood flow to the brain.
Okay. What kind of treatment does Sparrow TCI provide for this?
So we have a variety of multidisciplinary treatments. We often start with medication because, given that it's Heart Month, PAD also coincides with heart disease or coronary artery disease. So medications to reduce risk. And then for the patients that are significantly symptomatic, we can offer endovascular therapy with balloons and or stents. And then for the most severe disease, or disease that's not amenable to something less invasive, even open surgery.
Okay. Talk about the epidemic of critical limb ischemia. I don't even know what that is, but I know you do.
Thank you. So critical limb ischemia is the most severe manifestation of lower extremity peripheral arterial disease. And that's where the disease is so far advanced that the blood flow is so compromised that people either have pain at rest in their lower extremity, foot or leg, or actually develop wounds. They develop ulcers or gangrene. And left untreated, it can result in limb loss. And then more importantly as well, these patients have a very high risk of associated heart attack and stroke as well. So we often treat these people with endovascular means, balloons and stents, as a first-line therapy. And then for some of the patients, surgical bypass can be available at Sparrow, which may not be available at some of the freestanding facilities that exist around Central Michigan and elsewhere. So in other words, balloons and stents are lovely and work very well for a majority of the patients, but surgical bypass is also an option.
Dr. Joel Cohn, cardiologist, Sparrow TCI, thank you for joining us for Heart Month. Take care.
Thank you.